Atul and Rupa both are doing a fabulous work.
Can I ask a question?
Please, please.
Yes. As you are saying that about the pesticide, how can we arrange patients to bleed their fruits, vegetables, whatever raw they eat? Is it possible with salt water or something like that?
I can always, I try to work on one thing called hydrogen peroxide, or there is a thing called ozone now that on the TV you get Hema Malini, she will tell about ozone, how to use that. But I can always use hydrogen peroxide, doctor. Use 2 spoons of hydrogen peroxide and use it for cleaning the vegetables.
Do you think I could add something to that?
Yeah, please, please.
Okay, I personally use.
I acknowledge Manik Mixindani sir, and it was great for you to hand over all the time. And please, please.
Okay, I have used vinegar and hydrogen peroxide to wash vegetables and fruit earlier to use it for a great many years. Okay, it helps to take out the pesticide on the surface.
Just to wash it.
The proportions I generally use for every liter of water, I use a tablespoon of hydrogen peroxide and a tablespoon of household vinegar as well. I leave the vegetables and fruit in there for about 20 minutes to 30 minutes, then we rinse with clean water, dry it and store it in the fridge for further use. That may be useful to somebody.
Thank you, sir.
Okay, I would like to add something.
Yeah, please, Ravi.
See, what I do, I take a bowl of water, I put the protection program crystals in that.
Yeah.
4 to 5 crystals. The color water changes, and then we add cut vegetables and fruits in that for 20 minutes. So protection programs does nullify a lot of pesticides and kills bacteria, virus, and
Perfect. I can always add one thing here which I always was a keen fan, is you always try to keep glass bottles. I try to use my glass bottles, and I can always tell you this is something which has helped a lot way. Keep this, we have abundant sunlight here. This glass bottle, whatever you are using, use that glass, not plastic, and keep it in sunlight for 2 to 3 hours. And take that water and use whatever you like. You want to ingest, and you want to wash your things and all that. That is a structured water. It should help you in a bigger way. Yeah.
I'd like to add one thing on this business of incandescent lights and melatonin as well.
Yes.
Melatonin is normally stimulated by sunrise. And the melatonin secretion peaks 12 to 15 hours after exposure to sunrise. Okay? So when you are using incandescent lights as a source of melatonin, I don't think it's very scientific or effective in that way.
It's
That's my
better
personal assessment. What I have seen, that when you have lights on late at night, it does tend to cause the secretion of melatonin later on in the day, which does tend to make you a bit drowsy and sleepy the next day during your hormones. I would consider that really as another input for some people to think about.
No, I think you're absolutely on the correct this one. Only thing is during that 6 to 10 o'clock, what is the light which you are using? After 10, switch off all the lights. And try if you can. Yeah, and if you are, there is one more thing which I think we are still not yet got is the smart meters and all that. And I have seen a lot of leak out and all that telling us to not use, they tell not to use any electricity gadget and all that. Not to keep your, even if you have got the latest fridges and all that, double doors and all that, not to keep near your bedroom because it is causing that EMFs to increase. And
Srinath, you should actually keep any electronic gadget at least 1 meter away from your head.
well,
A
yeah,
lot of people have the switches just next to their head.
well,
That's been associated with a lot of.
I'm happy questions are coming, and Chakrapani ji, as energetic as passionate, has come up with one more question. Thank you.
I would suggest for the benefit of all of us that some of these questions are listed out and we will make a reference to the CSIR institutions that are doing work in this particular arena. I have just listed out about 6 to 7 institutions, CSIR labs, which are doing work in the chemical sciences. Similarly, there are about 10 to 12 physical science laboratories. In fact, I was trying to list out these for the benefit of the degree and junior college students. So I think all these are very relevant questions. If you can kindly list out and pass them on to Mr. Praveen, I would take it up and make a reference to the concerned directors and see whether do we get a response from them, which will be a very informed response instead of all going around. If you agree, that's what I was.
Maybe sir,
Let
it's
me
a
say something, Mr. Jagimani. There's a lot of information out there already. But what we need now is to implement all these things. We are facing a climate emergency where our world is heading towards the end. Any action must be taken now. And in searching for more information and not using the one we've had for so many years, taking this anywhere. Plastic, for example, should be banned worldwide because it's polluting our oceans. We need to cut down on air conditioning, we need to cut down on heating, we need to cut down on coal and gas. I mean, we can talk about these things for the next 100 years, but we're not ready to speak about it. So I think really what we need is a call to action as opposed to continuing to discuss. We can go to CSIR and they'll give us more information. But unless the organizations which implement actually take action, it is wasting our time.
Yeah, I agree with you, but the only point is in a government setup, if there is an information of some of these things, if there is already information, I'm glad we'll take it on board. But
If I may say something, maybe there was information about COVID. The government didn't pay any attention to the scientific information. But if each person can inspire those people around them to start making changes, oceans are built a drop at a time. How many people who are attending this have got solar power? How many people they are leading an ecological life? How many physicians here tell their patients to do something about that? What we need is change. Talk is cheap, sir. Action is not.
no, for instance, I think the point was made about what is this glyphosate?
Glyphosate.
See, these are not permitted in some states. These are permitted. There is no government order banning them. So I think some of these things we need to take up with the concerned authorities. Even the commissioner or the lower functionaries may not be aware of it. I mean, if they are aware and then if are subject to a lobby, that's a different matter. But where there is an awareness which is needed, we can certainly build that. That's the only point I'm trying to
The way we supply glyphosate, as you say, is well known worldwide. It is worldwide and has been known for many years. What has our government done about it? After it has been banned elsewhere, it has been allowed in our country. So what we have, sir, is that each person here can actually start growing their own vegetables, at least protect yourself. Changes happen when individuals start making them, sir. We wait for them to come down from the government. We wait another 100 years.
Yeah, but then you can only stop it with a legal force if you are backed up by a government order. If there are already orders, as you rightly said,
Our
we
government
can.
orders implemented, sir.
Pardon?
Our government orders implemented.
Okay. Now, see, I think we are getting into a bigger issue of implementation. That's a different matter. I don't think that discussion will take us far in this limited 1 hour. All that I'm trying to say is, if it is a sensitization at various levels, that can be done through various functions of the government. That's a limited point I'm making. Okay, thank you.
I would also make this point, sir, that individuals, they start on their own. You have those.
The other thing is you can take this into various training institutions related to government and then try to sensitize them. I'm sure a number of government training institutions are not even aware of it. I'm talking the ATAs, Administrative Training Institutions.
Me, sir, what we had understood is most of the doctors are not aware about glyphosate toxicity.
See, that's a point. See, one is a lack of knowledge. The other is an affirmation of what is still to be affirmed. It's a combination of these two. Of course, in the field of implementation, there are gaps. We need to. Thank you.
Yeah.
Widely, and there is no story that patients are going to follow. Because the moment they stay in city, so it becomes quite difficult for them to come out from there and they have to lead an ecological life.
Madam, I have more vegetables in my balcony for more than 40 years. More than 40 years. And many of my patients have been inspired to do the same. The examples we set can change the world.
Because we are saying we have to start from ourselves. Yeah.
Because the essentials for life are clean air, clean food, clean water.
Yeah.
These are at a premium worldwide.
Yeah.
Urban India is especially worse. We have the worst polluted cities in the world in our country.
Yes, so because I am sitting in city, and if I will start working like this, so for next time, people who don't have time, who are not interested, not paying attention, they won't be back. You know, that
Madam, I assure you they will. I have more than 10,000 patients of mine growing their own vegetables. More than 10,000 because I give them, when they come to see me, I give them vegetables from my balcony to taste.
okay.
I said, taste it and see the tomato from my garden. I pluck it straight from the tree. You taste it and tell me if it tastes any different. They say, doctor, how hard is it to grow the vegetables? Use a flower pot, use a cold wash basin. Get the soil, plant it, let the leaves go into it. Your plants will grow automatically.
Yes.
This is natural stuff that is grown.
Yes.
I am living in a village, by the way. I've changed from living in a city to living in a village where I grow dozens of vegetables. Vegetables and my food is grown myself.
Yeah.
So we can do it. We won't do it, but it is very easy. We put ourselves on the line and
It's not the quality. It's all the
Yeah, one second, now 1 second. Atul, I have got with me Ambassador, Dr. Ambassador Vinod Kumar. Ambassador has gone, he is I just want him to say a few words about this particular. He came all the way offline and now we people are not meeting offline. Manik, I think Dr. Manik, Sir Hinarandani ji, this is amazing inputs what you have given. I would like to go, the first thing I tell my wife is, let us go in the home kitchen and all that. She will start putting hand on our, ये नया क्या शुरू हो जाएगा. Okay, fine, yeah, but that seeding was very, very important. I think all of us has to take a clue about that and start working because we cannot go, whatever we are getting, this scrap vegetables, we are into a real disaster. Ambassador Vinod Kumar, thanks for coming. I don't have a TV setting here. You are known to talk in TVs and all that. Please, sir. Please.
Thank you, Dr. Saxena, and then the other colleagues participating in this wonderful event. You are all aware, of course, we need not stress more about these, whatever the changes taking place, particularly in the science, so-called science. Sometimes one wonders what to take, what not to take. We need minimum few things to survive: air, water, sun.
Next.
These things are there. Are we getting fresh, free from polluted air? I wonder, many of us are not getting. Early morning, of course, daily I get up at 4 o'clock and walk around the lake in the Madhavpur, that whatever, Gurgamchuru. Because I used to walk miles together in Germany when I was there, in the forests and various things. One is for this, of course, to keep your body in good, whatever, fit condition,
That's it.
and to get the fresh air. Unfortunately, yes, the growth, in the name of growth, we are messing up so much and we are depriving ourselves and observations coming later on, because the pollution is so much, very difficult to say. Particularly, the most polluted city in the world is the Delhi. Once it used to be Beijing or something in China, but we are overtaking everything China. Not only in pollution, then population, whatnot, all those bad things we are overtaking, but good things China is taking care of, advancing themselves, and they are trying to control the bad things like whatever pollutions. For example, when I was in Germany, one of our textile minister was there. I was taking care of his visit. He wanted to buy few things and to take back to Delhi. Then some small garments for his granddaughter and then grandson. He picked up few things. Then I told him, these are made in China because inside they will. And people say, once you wear it, you get certain whatever skin problems because of certain chemicals used for manufacturing of certain things. So, such type of whatever, even the chappals from the China made things, when they used it, they got some sort of problems in the soles. So, all those things because of the chemicals. What I'm trying to say is, everything, whatever you touch, whatever you need, getting polluted, contaminated. So how to overcome this? I think it's high time. The man, Mahatma Gandhiji is saying that yes, there is everything available in the world to satisfy the need, but not the greed. So people are after greed. Because as a general surgeon, as a practicing doctor, I did so much before joining in the Indian Foreign Service and becoming the ambassador or high commissioner, going around the world. That's a different entity. But during my practice, I did notice many of these things are diseases are iatrogenic. Means you get all these things because of your deeds. You take it. You take a medicine, you fall sick. You take whatever food, you fall sick. Because even the medication here, Sarah saying that yes, statins are not good. Yes, we know. But the lobby is so strong and their propagation is so strong. People take it. For example, even myself, I just went for a cardiac checkup. One of the cardiologists he said, no, doctor, you have to start the statins. I said, no, I don't want. Why should I take? Even I don't have this cholesterol high. Even I don't have any complication. No, you are now 67, 68. You know, there is some sort of the non-confused area in your heart. You should take it. No. Now you are a diplomat, I know, but I am a cardiologist. You have to follow my advice. I said, no, I'm sorry. But what I mean to say, the doctors, the medical fraternity also is influenced by these whatever industrialists and then particularly the pharma industry. They are, I think, unnecessarily forcing people to take all these medications which are not necessary and then leading to the problems. They were supposed to solve the problems. Where there is necessity, you have to take the medication. If you are having a high fever, you have to control it immediately. You take a paracetamol tablet, that is okay. But if you go on taking paracetamol for whatever small pain, oh, my neck is paining, take one paracetamol or ibuprofen. The things have come to that extent. The medication is causing more problems than the relief. We have gone to that extent. Now the pesticide, as Reddy is saying, yes, these are causing so many things. Do we need this? Not at all. But the Monsanto or the whatever the multinational companies are so strong, they advise all these things, and then the but now they are not available. And then whatever available is not giving the strength or giving health, but it's damaging. So I don't want to go into so many details because now we are scared of even breathing or drinking water or even eating certain things, even fruits, whatever you eat, whether they are causing or giving energy and good health or causing some sort of carcinogenic effect in our body. So we are in such a world, difficult even to breathe, such thing has come. Because of our own whatever activity, it is not that something is coming from above, no. Something is caused by our own people. We hope that Saxena, like whatever good doctors with intentions and Dr. Reddy Garu with whatever your knowledge and research and all other whatever colleagues having good knowledge going into the society and informing the people the bad effects of what is happening, and then at least some pressure bringing on the governments and then policy makers to look into this. For example, let us even think of what is happening about this COVID. So many things are happening. Actually, of course, one should use the mask. Mask protects, prevents, but the vaccination policies, certain whatever medications. During the COVID, so many people asking, write this medicine, write that medicine, take that medicine. I was taking so many medicines, I am still practicing. Free service I am giving, day and night I give it. I never prescribed any such sort of antivirals, antibiotics and then whatnot. I see certain doctors prescribing more than a dozen items for a COVID patient. I never did so many things. I used to tell them like whatever. Your immunity is the best protection. No more drug can kill the virus. Your own body, your own cell fights the foreign body entering into your body. So you strengthen it. How? Thing is, yes, vitamin